Dental fillings play a crucial role in restoring the structure and function of a tooth that has been damaged by decay or trauma. There are several types of dental fillings available, each with its unique set of advantages and applications. In this video, we will explore the different types of dental fillings and their uses. 1. Amalgam fillings. Amalgam fillings, also known as silver fillings, have been used in dentistry for over a century. They are made of a mixture of metals, including silver, tin, copper, and mercury. Amalgam fillings are incredibly durable and can withstand the forces of chewing, making them an excellent option for molars and premolars. However, some patients may be concerned about the mercury content in amalgam fillings, although research has shown that the amount of mercury released is minimal and not harmful. 2. Composite fillings. Composite fillings are made of a mixture of plastic and glass materials. They are tooth-colored and blend seamlessly with the natural teeth, making them an excellent choice for visible teeth. Composite fillings are versatile and can be used to repair small to medium-sized cavities in any tooth. They bond directly to the tooth structure, providing additional support and durability. Composite fillings are also preferred for individuals with metal allergies or sensitivities. 3. Ceramic fillings. Ceramic fillings, also known as porcelain fillings, are made of a high-quality dental ceramic material. They are highly durable and resistant to staining, making them a popular choice for front teeth and visible areas. Ceramic fillings can be custom-made to match the natural color and shape of the tooth, providing a natural-looking restoration. They are also biocompatible, making them suitable for individuals with sensitivities to other materials. 4. Glass ionomer fillings. Glass ionomer fillings are made of a mixture of glass and acrylic materials. They are known for their ability to release fluoride, protecting the tooth from decay and strengthening its structure. Glass ionomer fillings are commonly used in children and individuals with high cavity risk. They have a relatively short lifespan compared to other types of fillings, but are an excellent option for temporary restorations or low-stress areas. 5. Gold fillings. Gold fillings, also known as gold inlays or onlays, are made of a solid gold alloy. They are incredibly durable and long-lasting, with an average lifespan of 15 to 30 years. Gold fillings are custom-made in a laboratory and require multiple appointments to place. They are a preferred option for individuals who grind their teeth or have a strong bite force. Gold fillings are biocompatible and do not cause any allergic reactions. 6. Resin ionomer fillings. Resin ionomer fillings are a combination of glass ionomer and composite materials. They are tooth-colored and release fluoride, providing added protection against decay. Resin ionomer fillings are preferred for small cavities on the root surfaces or areas with low chewing forces. They are also commonly used in pediatric dentistry for their ability to bond to the tooth structure. Resin ionomer fillings have a shorter lifespan compared to composite fillings, but are an excellent option for certain applications. There are several types of dental fillings available, each with its unique set of advantages and applications. The choice of filling material depends on various factors, including the location of the cavity, the patient's aesthetic preferences, and budget considerations. It is essential to consult with a dentist to determine the most suitable type of filling for your specific needs. Dental fillings play a vital role in preserving the health and function of your teeth, so it is crucial to choose the right type of filling for optimal results.